everybody. Welcome to this week's It's Worth a Shot. I'll just kind of slowly go through the intro here as people are joining in. Today we are going over updates, questions, and answers because we've had a couple from the past couple of weeks that we finally got answers to. And then Crystal Morse will be here today, and she's actually going over the escape room that she has pioneered with a couple other partners. And so we'll get a more in-depth look at that. Next slide. So as always, we want to thank you guys very much for maintaining coming to this webinar on a weekly basis. It really helps us help you with this half hour that we spend with you each week. And also we want to thank all of our partners and speakers, guest speakers that have joined us. We really do appreciate the collaboration that we have going on here. We do want to remind you that we have a, oh, I forgot the word for him. You click on the link and then fill out the, guys, help me, what's the word?
The survey?
There we go, yes. Oh my goodness. For the presentation. So if you guys can get in the chat and click on that and complete it while we're having the call or after, we would really appreciate it. Next question, or next slide, please, Mary. So again, like we want to keep this going and we do have ideas on our calendar, but if there's any pressing topics that you guys would like for us to cover, we'd really appreciate your ideas. So go ahead and place those in the chat. And again, we do have this webinar every Wednesday. Next slide. Oh, sorry. We do have a polling question for everybody today. So if you want to take a look at this, the facility experiences these challenges with access and use to electronic immunization record use. So if you can select any of the, we do not have access to immunization records, don't have time to ask or accept access or know how to request, not been trained to use, profile expires routinely, no challenges with the accessing, and then if there's anything other, then go ahead and chat that in for us. But we just like to know if you use your electronic immunization record. Nice, looks like a majority have the no challenges with us accessing today, so that's good. We'll give that a couple more seconds and then we'll close it out. All right, and then we had a couple questions last week about vaccine accessibility, and there was a lot of questions on the safe medication disposal products and resources from Jesse's presentation. So in order to get the information out in a timely manner, if you would ask, just send an email to Jessie Kenzie. So the email is right there in the on the slide, and I'll also pop it in the chat box for us. Or for you guys to copy, but if you could just send her an email and let her know that you would like more information on access to the bivalent immunization, or if you have questions about the presentation she did for the medication disposal and any of the resources, or the free, well, it's November now, so I think the free gift that she for the disposal bag was just in October, but she can definitely share all that information with you guys. We'll go ahead and go to next slide, and I'm going to pass it off to Kyla here, who's going to go over the weekly flu shot information and then go over the last week's questions and answers.
Thank you, Miranda. And one more thing, just as you were talking about the bivalent questions, I did put in the chat, we have a top 10 bivalent question handout that we've put together for some of the questions that just kept kind of repeatedly being asked. So check that out. It is posted live on our website now. And as far as flu activity, we're seeing influenza A cases go up pretty steadily. I know in Alaska, we're starting to see sea flu. Some of the providers said they're really starting to see it pick up. So make sure that everybody gets their flu shot. Next slide, please. So this question came up last week. It was related to if folks were seeing residents who were recently testing positive with COVID-19 after receiving the bivalent booster. So there's a couple things to consider when answering this question. First of all, those antibody titers do take a few days to get up to their peak immunity level. So if someone was exposed to COVID-19 prior to getting their bivalent vaccine or right around the same time, they could still be at higher risk because of that delay. Also, just to clarify, the bivalent booster cannot give you COVID-19 because it is not a live virus. And thirdly, even with boosters, we know that really the end goal of these vaccines is that they don't protect 100%. But what we want to do is make sure we reduce severity of disease, hospitalizations, and death. So if folks still test positive, they will have a lower risk of all of these endpoints. Next slide, please. So these are some questions related to state survey and what they're looking for as far as employee resident masking and symptom screening. So the Bureau is aware of the updated COVID-19 guidance as of September 23rd, 2022 from CMS and CDC. As guidance and recommendations change, a facility should reassess their current practices and modify policies and procedures to better align with the current guidance or recommendations. But at this time, CMS has not provided the state survey agency with any guidance that would prohibit the implementation of these new recommendations. And of note here as well, all provider types will be expected to have masking requirements when an outbreak is declared or if community transmission rate is high. So you can find the community transmission rates at this link. Maybe if somebody could put that in the chat, it's the county view tracker. I can do it when I'm done presenting.
I'll grab it, Kyla.
Okay, thank you. The Certification Bureau surveyors and managers will be reviewing the COVID-19 Integrated County View daily, which is updated Monday through Friday by 8 p.m. Eastern Standard Time. And each facility will be expected to review their community transmission rate for their county during the times that it is actively being posted Monday through Friday, excluding holidays, and adjust masking requirements as recommended based on their transmission level. We can go to the next slide. What do you foresee as tags for the new definition of up-to-date vaccination status for residents and healthcare professionals? All of my staff have met the federal vaccine mandate, but there is tremendous distrust of the continuously changing guidance regarding vaccination. So the new update was just released related to vaccines and has not been thoroughly reviewed at this time. So we do not have a definitive response to this question at this time. We will be covering, not next week, but in the next 2 weeks after that, some of the phase 3 updates. So that might be something that would be making sure that you're keeping up to date as far as what those tags are that have been put into regulation. And I think I will now turn it over to Crystal.
Oh, there's just one question, Kyla. It says, my understanding is they are updating every Thursday by 8 p.m. And I believe that is the correct changeover. It is on Thursday, not Monday. So we'll make sure we correct that slide before we send it out.
Okay, on the flu activity we're talking about, right?
Correct, for the
Okay, yeah, thank you very much for that. We will make sure and do it in a timely fashion.
This is Jill. No, not the flu. It's the data tracker for the CDC for COVID.
Oh. Okay,
yes.
You guys are better qualified to answer that.
Yeah, so the tracker's updated once a week by the CDC, and that's on Thursdays.
Thank you, Jill, for that clarification.
You're welcome. Thank you.
All right, Crystal, we're excited to hear about your escaping.
Okay, well, I'm excited to be here. So last time I was here to talk to you about our Project Firstline escape room, we were in the initial data collection pilot study of how this was going to work and where it was going to go, and if Project Firstline would even adopt it and go for it. So good news is they did, and we are up and live and we're ready to go. So I'm here to celebrate and share it all with you today. So again, I wanted Jill Holt, thank you for coming up with this title. I thought it was quite clever, but today's presentation is Escaping a Creative Journey Through Infection Control. So next slide, please. So I've talked to you all. I hope that Project Firstline is familiar to you all. You've heard of it in some form or fashion, but just as a quick reminder, this is CDC's collaborative on infection prevention and control. They're really focusing and honing in on the micro learning content. So what we do know, what we heard loud and clear is that healthcare workers no longer had the time to sit and watch webinars. Going through hour-long trainings was just a thing of the past. So we've been mindful of that, and we've come up with some innovative, creative learning styles for you all to learn today. Next slide, please, Mary. So just to kind of give you a better picture of what this lift was all about, it was quite heavy. And so all these partners that you see on the screen today, we're very grateful for. This is who helped in the collaboration of the Project Firstline Escape Room Training Collaborative, or has participated in some form or fashion of some sort of I guess now I'm at a loss for words, some form or fashion of infection control and spreading the word on training. Go ahead to the next slide, Mary. So this isn't a concept that I came up with. I wish that I did, but I didn't. It's been around for quite some time. So the escape room it's a game. So for the of you who have never participated in an escape room, it came out in the early 2000s. And what it is, it's about team-based care. It's a team-based approach. So you are relying on your teammates and your team members to help you problem solve. You're critically thinking, and you're getting through this as a team. Which on every training that I've collected the data from, they love the team concept. It's very inexpensive to do. And lastly, it's fun. It's a fun way to learn. So when I approached Casper College about implementing this into the College of Health Sciences, I asked them, how do you go about training onboarding the students on infection control? And what they told me was we're using CDC's, and I can't even remember what content they were using. I guess it's irrelevant on that, but what were they doing was they were setting their students in front of videos. And I said, well, what do you think? How much retention do you think that they're retaining from doing that? And they're like, well, we're really not sure. And I said, well, how about this? What if we took that content and we made it into a game? And so they were all ears at that time. And that's how we recruited the College of Health Sciences and the students to help. Actually, it was them who came up with the Captain Germ Be Gone, as you see on the screen here. And it was them who came up with the theme. So the theme is to this escape room is this Captain Germ Be Gone is at each station that you go to, he's being outwitted, or he's trying to be outwitted by an arch enemy of his. And you are his allies, you're his teammates, and you are trying to save the universe from infectious disease threats. So that's the premise of the game. Mary, if you want to go to the next slide. So here's the core principal learning objectives in the escape room. So the participants are going to learn hand hygiene. So they're going to learn how to define it, first of all, but they're also going to learn how to demonstrate it in the correct steps. They're going to learn about source control. And what is source control? When I ask them, they don't really know. They don't really know. They know somewhat, but they don't know how to define it or explain what it is. We'll talk about how respiratory droplets spread. We talk about correctly donning and doffing of the PPE. So, you know, your team is instructing you how to correctly do it, and the facilitator makes sure that it is correct and done correctly. And then lastly, this is where a lot of people learn is from the cleaning and disinfection. So we talk about why contact time matters, what it means, and how they can identify high-touch surface areas in their healthcare facilities, which you'll learn about a little bit later. So if you want to scooch to the next slide. So what we know, what we've created, so as I mentioned, we used resource from Casper College, those students, which they loved, they got into, and they helped create the content. So know your audience. So what we did is we created the escape room at a 5th grade reading level. So again, we didn't use a lot of medical jargon in there, and if we did, we defined it. We created the content to any sort of education or background. So this has been quite popular in nursing homes. And so what we've asked is to include your non-clinicals, your clinicals. So it's been a great learning experience, and it's been exciting to see and view how these teams come together. So I'll give you an example. The last nursing home that I was at, their activities director was in there. Their environmental services person was in this escape room. They had their infection control nurse in there, and I heard the nurse coaching these folks on the correct way of doing something. So they learned from the nurse, and the environmental services the dietary staff was in there, and everyone learns from everybody. It's a team-based approach, like I had mentioned. And then the videos that I told you that we use the content, we went through an inside infection control, and this is located on CDC's website, which is in the end of these videos. But what we did do is this 30 minutes, you feel like you're in there for 5 minutes. That's how fast the time goes by. So we made the story fun, and we made it competitive, almost stressful in a way. So when I holler out that I give them 10 minutes. So if they've already used 10 minutes, I say, okay, 20 minutes are left. Then I go to 15 minutes. So you can feel like they're like stressful, but they're having fun, they're laughing, and you can see that they want to win. They want to get through that 30-minute timeline. So as you can see here, this is an actual picture that we did take from one of our trainings. As you can see, they're all looking at it. They're all trying to figure out the puzzle to the next clue. Next slide, please. Here is another couple pictures that I want to draw your attention to. So as you can see on the left hand, they have their dietary person in there. Actually, that is dietary folks on the left-hand side. And then the clinicians are on the right-hand side. Next slide, please. So here's our outcomes so far. So far, since the launch of the escape room, we have trained 109 participants. We did this through a Likert scale. So this is how we collect the data. So the average score of their, what they knew before was a little bit over a 3. And then what they knew after increased a whole point. So it was effective, it does work, and they do learn. Out of those 109 participants, 76% showed they showed improvement after the training. What I think is quite amazing, though, is that we trained 49 train the trainers. So this is somebody that they can in their own facilities, they can demonstrate, they can know how to take somebody successfully through this escape room training. So it was pretty awesome to train all those train the trainers. And I guess the most important thing is that a majority of the participants did show increased knowledge of the topic, and they were able to explain the why behind why they're doing what they're doing, why we're teaching what we're teaching, and how they can teach others to as far as infection prevention and source control. Next slide, please. So I want to share with you some qualitative data that we also collected, which I love seeing this part. So it says, would you like to comment about this training or your satisfaction towards the training? So here's the responses. So occupational therapy student said, I like how this was interactive and team-based. I learned better through activities like this. One of the pharmacists was, I did this training at a FQHC, a federally qualified hospital. And the pharmacist on that team was very competitive. And she said, this was a great experience. It was fun and informational. A nursing home administrator that went through the training. This was fun, team building activity to improve knowledge, a true win-win. And then one of the registered nurse and the infection preventionist that went through the training. I love this type of learning. You nailed it. So that's just kind of the very few of the very many positive comments that we've gotten so far. And then you can slide to the next one. Okay, so here is, I actually want to show you, I want you to take you through it. So it's not going to take you fully through the escape room, but this is going to give you an overview of what an escape room, if you've never done one, you're really not trying to escape rooms by any means, but you are all in one room and you're again, this video will explain it in better detail. So you can go ahead and play the slide.
Yay! Okay. No, oh goodness. Okay. Puzzles. Puzzles. Corners. Corner piece. Maybe the numbers are going to be lit up.
Probably going to be lit up. Yeah.
Numbers are the letters. Check on top.
Letters.
The numbers on top. Yeah.
It's 0.
Hold up.
F done.
What else is on here? You think?
No. But there's that one thing right there.
Huh?
On the glow germ. I mean, if you shine right there.
Yeah.
So do we have to clean you up?
Oh. What? Check one of those.
It was blue.
I think we have to do something here.
Good thing you hooked it up.
Down. Other way. Put face. Yeah, like that. Oh. 2 numbers are correct, but in the wrong place. So 9 must be one of them still, right? If one number is correct, so 1 is 9.
6 is the first.
What is your reaction to the Project Firstline escape room?
Oh, we had so much fun. It was exciting, and we worked together as a team,
Yes.
and we just loved it.
It was a blast. We had so much fun.
Awesome!
I loved it. I'm bringing it to our building.
Thank you, Project Firstline!
I don't know about you all, but I think that looks like a way better and more fun way to learn than sitting in front of videos. So I hope you're all with me on that one. Next slide. So I think I have about, I don't know, I have a few minutes. So would you all like me to show you the manual? What it looks like? Yes, okie dokie. Let me, Mary, would you mind if I shared my screen? And Miranda, thank you for putting in the link. So the link that you're seeing in the chat button is the link to download. As I mentioned earlier, it is approved by the CDC and co-branded, and we're good to go. So it is there for you to utilize. But I do want to show you, because I don't want it to be intimidating to you by any means, and I want you to reach out to me as a resource. So let me know when you can see my screen.
We can see it, Crystal.
Okay. So as I mentioned, this is a superhero theme, so it's quite colorful, but as you go through the manual, you're going to get a supply list. So all this can be ordered off Amazon. It's about $200 to order all the supplies, just so you're aware. But again, you can reuse some of those supplies, and as long as you keep them disinfected. Here's the story. So I like to have a breaking news headline. So some sort of emergent sort of SOS, and somebody usually will have it download something on their phone, which is kind of fun. But again, you make it what it is. And so the breaking news is that we need your help. The superhero needs your help. It's up to you to help outwit his arch enemy, and it's up to you to help create or break free from any infectious disease threats that are threatening the universe. So in here, it says you have 30 minutes to navigate the escape room. We want you to stay together as a team. So if you break apart from your team and go to the next station before you get out of the first station, you'll get a 10-second penalty added to your time. And then there is some opportunities in here where you're like, oh boy, we're running out of time. I don't know if we can solve this. You are allowed 2 hints, but it will cost you 30 seconds, just so you are aware. So here's the final puzzle. Is this each station, you get a puzzle piece and you put this together as the final puzzle. But along the way, you have a facilitator, which could be you, anyone from the building, but you make it fun. So you read clues to them. Here's the puzzles. Here's how to correctly wash your hands. It takes you through those steps. So you hear your participants singing happy birthday, and they're laughing and they're joking and they're having a good time. As you can see, this puzzle is backwards. So in one of those escape rooms, there's a mirror. So you have to figure out, oh geez, this is backwards. I need to use that mirror to read it correctly. This is another one that you have to write in with invisible ink, and they'll have to use a black light to get the message. We did paper dolls. So want to remind you, this was created at the height of the pandemic. So we had a shortage of PPEs. So if your facility doesn't have or can't afford or doesn't want to use PPE, we did paper dolls. So we tried to think of it all. Here's one. So here's one clue. What has a thumb and 4 fingers but is not a hand? Anyone want to take a stab at that? A glove. So Maria, you're exactly right. I want you on my team. That's it. So that would be the next clue to go to the next station. Here is a puzzle piece on high touch surfaces. So you saw them in the black light, or they were using the black light on a computer keyboard. This is where they got that clue from. It comes with, just so you're aware, it comes with objectives of this escape room, what they're going to learn and what they're going to be able to identify at the end. It takes you through station 1, all the supplies you need, how to set it up, the run through, station 2. So I won't really go too much on that, but here in the red, this is where you know need the facilitator to read. So station 2, if your mask is ill-fitting and doesn't cover your nose and mouth, you can breathe in viruses and things can go south. Don't make that mistake at station 2, or I'll be there to get you and you won't make it through. And then just lastly, I want to take you to the very end because I know we're at time. But the very end, you read them this clue right here, and it says the grand finale of it all. So once they get their 4 puzzle pieces that they collect at each station, which look like this, you thought you were finished. It turns out that you are missing the most important piece of the puzzle. And they're like, oh. So then you ask them, what is the most important thing missing? So they put their puzzle together, and it's you. Everybody is responsible for infection prevention and control. And that's it. So I will hand it back over to Kyla or Miranda or whoever's going to close us out.
I've got it, Crystal. Thanks so much for the presentation. And again, if you guys would like any more information, feel free to email Crystal and she can definitely help, or any one of us, and we will put you in contact with Crystal. Next slide, please. So we just want to thank you guys for joining us this week, and we will have another presentation next week on Wednesday, just like normal. So we will see you next week, and everybody have a great weekend. And please take the time to fill out the survey for us. Thanks.